All right, we're just going to review your medical history here. Looks like you're in generally good health. It looks like you were diagnosed with Huntington's disease in 2010. You have regular visits with Dr. Costa. So some of the symptoms, loss of balance, trouble forming words.
Yes.
Okay. Anything else that you've experienced with that?
With the Huntingtons? No, not more just the memory loss than
Okay.
anything else.
Okay. And then do you take any medication for the Huntington's disease?
Not for the Huntingtons.
Okay. And then your regular visits are like every 6 months, like every other month?
Every 6 months.
Every 6 months, okay. Let me just go ahead and edit this form. So we're gonna go down to...
Dr. Costa is my regular doctor, not my Huntington's doctor.
Okay, let's go ahead and put that information in for your regular doctor then, if you know the name of who it is. Okay.
And your mom will know.
Okay, we will just edit that and see if we can get some information from her. But let me just put in there that you do your every...
He's every 6 months. Dr. Costa I see once a year.
Okay. Okay.
Unless I need to have, unless I have other needs.
Okay.
But annual visits are all I usually go to see.
Okay.
And sicknesses.
And so your patient is ready. Check out
And he's the one I get my medicine from for just regular,
Okay.
what's the word I'm thinking of?
Depression?
Yes, depression. Alexa.
Okay. Every 6 months. Okay. All right.
So I don't take any extra medicines for my Huntington's
Right.
yet.
So you take the citalopram, 20 milligrams, 1 capsule per day for depression,
Right.
and then you take the elazapine, 5 milligrams as needed for relaxation, for sleep. Okay, relaxation and sleep. Okay.
PRN.
I'm sorry?
PRN.
Okay. All right. So... No allergies or anything?
No, none.
All right. Okay. Looks like you didn't have anything else here. No blood conditions.
None.
Okay. So, do you have issues with sleep with your Huntington's?
No, not at this time.
Okay. Okay.
The as needed medication that I have, I will never ever take it. That's how it's just never.
Okay.
It's not something that's used very often. Now, would you have it there that's available in case I need it? But I have never taken it since I've had it filled.
Okay. Do you have any other medical issues that you would like to discuss, or any problems or symptoms that you are having?
I am not. Everything is peachy, and thank you for asking.
Okay, we're just gonna look at really quick your vitals that we went through today, and then we should be able to get checked off here for our health history check-in. So height 5'9", weight 200 pounds. Your temperature today was 95. blood pressure was 135/80, which is hypertension 1, respiration 16 with ease, pulse 96 regular. Puts you in the ASA classification of 2, and you have no complaints about your teeth today.
Right, but I don't know what you just said about before the no complaints.
Oh.
You started to say something?
I was just going through your vitals.
Right.
And then I put your ASA classification. So just because you
The
have
hypertension to 1?
that, and also because you have Huntington's disease.
Oh, okay.
So,
Sorry, that's what you must have said, and I didn't hear you because I was being drowned out. Okay, that's all I was trying to get you to repeat.
that is A-okay.
And then right after that, you asked me if I had a meeting left.
Yep.
Okay. Good.
Okay, I think that we are good here. I just want to double check some things here real quick.
Chair 40, your patient is ready. Chair 40, thank you.
So we did go over the citalopram, and we did go over the olanzapine. Okay. Have you had any issues with swallowing lately at all?
No, it's fine.
Okay. All right. Okay, I think we are good. After reviewing the video that I made today with my client for his health history, I was able to look at my body language and felt that it was confident and appropriate. I felt like the review of medical and dental history, there was a thoroughness and questioning to dig deeper and find out what was really going on with his condition. I was able to exhibit great understanding of the client's condition, being as it was somebody that I was related to. Also, researching a little bit more ahead of time and just being able to ask those specific questions on symptoms that maybe he was experiencing. And my reflection for future improvement included possibly turning more towards the client instead of having my back to him and then having to turn my head over my shoulder. I think that was my biggest drawback. That's the thing that I needed to work on most. Other than that, I felt pretty confident. I felt like I was able to ask questions and be able to reciprocate and understand what it was that he was saying and be able to note that in my chart.